So, our first speaker this morning is Kathleen Morris, who is a registered nurse and has degrees in nursing and family science, with a special interest in families, health, and geriatrics. She worked as a nursing supervisor with the local home health company for 7 years before transitioning into care management. Kathleen established her own care management practice in 2024 in order to better serve the needs of the aging population of the DC metro area. Kathleen loves to work with seniors and their families to enhance their quality of life, independence, and safety for all parties. She believes in healthy life choices that benefit the whole person and is a strong believer that it's never too late to make positive changes.
Thanks for that nice introduction, Kathleen. Um, I'm Kathleen Morris. I'm a local, I wouldn't say Washingtonian. I'm from the DMV. I grew up in the Gaithersburg area, and I'm now in Silver Spring with my family over on the Leisure World side. So I didn't travel too far from home, but it's a great area, and I'm excited to serve the people in this community that need care management and let you know a little bit more about what it is that I do. So, care management, it's kind of a broad term, but the care manager can really help to navigate the complexities of aging and the many complexities that come with our current healthcare system. So, the idea is to optimize quality of life while also maximizing safety and independence. A care manager can be any healthcare professional who coordinates and oversees a patient's overall care. This involves assessing individual needs, developing treatment strategies and a care plan, connecting clients with services and resources in our area, and of course, advocating for their best interests. The nurse care manager would be a kind of a central point of contact between the client and their healthcare providers to ensure that the quality of care is optimized. Um, and this involves a lot. So every client I have is a little bit different in terms of their needs, the health conditions that they're managing, and where they are in terms of independence. But it's a nice service because it works with people where they are to meet their needs and then also optimize their health. So it would involve communicating with other healthcare providers. Sometimes I take clients to doctor appointments, take notes, and make sure that that any follow-up is completed, and that might involve finding a specialist or tracking down a medication or working with insurance. Helping clients find resources and navigating the healthcare system in general is another big part. Some people need more help with the day-to-day organization of their health. So that could involve managing doctor appointments, managing PT appointments, medication management, helping find caregivers for a client, or helping them move to a community like an assisted living or a CCRC. And then a lot of what we do is also communicating between the client and family if they're on the other side of the country or working full time or traveling a lot. I think as a nurse, I kind of bring a unique perspective to care management. All care managers are great. It can be geriatricians, social workers, RNs. You can get certification in care management. I feel a little better suited to manage the health side of things with a nursing degree. So I feel like that's a positive of having a nurse care manager, but I think all care managers are excellent at what they do. So again, sometimes clients come to me in the middle of a crisis, and I can jump in and help manage that and get things in place so that they're stabilized. And if they're coming home or moving, get all those services in place as well. Other people come in as kind of wanting to do long-term planning. So maybe they're getting a little older and seeing some friends that are declining in their abilities and want to make sure that they have a nice plan in place if something were to ever happen. So I would get to know them and kind of get to know their health history, what their wants and needs are, and then establish a care plan based on that. Um, at the onset of services, I like to meet everyone in person where they live and do a comprehensive assessment of their home and environment, check for any red flags in terms of safety. And then also that allows me to see what supports they need and how to best bring those in. And then again, finding good communities to move to in our area, which there's no shortage of communities. So sometimes navigating what the best choice would be for a particular person. Care managers are great in helping with that too. I wanted to take a minute to talk about ALCA, which is the Aging Life Care Association. I'm a member of ALCA. I know a number of our participants today are members of ALCA, but this is an association for aging life care professionals, and it just holds care managers to a little bit of a higher standard. So these are the 8 knowledge areas that that ALCA promotes. So legal, if you need help with establishing a power of attorney or a healthcare advocate or advanced directives or elder care planning, we have great resources for that. I mentioned earlier crisis intervention. A lot of times clients come to me in crisis, and I'm happy to jump in and help. And then other clients that I've had for longer, of course, sometimes have medical crises as well. So being prepared to jump in and help with that too. Managing ongoing health and disability, help with financial services. Sometimes that involves getting somebody with a good financial advisor or just connecting somebody with a great resource to come in and help them pay their bills and write checks and manage their budget. Housing, of course, if people can age in place, I think that's ideal. And making that happen sometimes requires bringing in outside resources. And sometimes people want to move and need to move. And of course, we can help with that too. Family dynamics are always interesting and can sometimes be tricky. So care managers help navigate that and make sure there's appropriate communication going on. And a lot of times care managers allow family to just be family and not be worrying so much about a client's health and appointments and ongoing management of chronic conditions. Advocacy, care managers advocate for their clients. They make sure they're getting the right treatment, the right resources, that they're being treated fairly. And then local resources, care managers have a great knowledge of local resources that cover all of these areas. As I alluded to a little bit earlier, every client I have is different. Everyone I've met in this industry is different, and everybody has different needs. So there's a variety of different services offered. I don't really have a generic game plan I use for everybody. It just kind of depends on where they are. So sometimes I meet with people for an hour or two and I follow up with a comprehensive email of resources and recommendations that I think would serve them well. And that might be the only interaction that we have, and they go on their way and feel better prepared to navigate. I also have people that maybe broke a bone and they're coming out of rehab and they just need a few months of support to get back on their feet and back to their baseline. And then I have other people that have long-term needs and need care probably through the rest of their life. And then I have a fourth kind of category of clients that will just call me if something pops up or if they have a question or maybe a very short term need that they need help with. But I do any and all of those, and most care managers do as well. And then some people I meet and get to know them for an hour or two, and then they're just kind of on the back burner if something were to come up. So yeah, and then my rates are starting at 185 an hour, and then I charge travel time just because in our area with traffic, you never know what's going to happen. And then to learn more, my website is morriscaremgmt.com. And then I also put the Aging Life Care Association website on there, aginglifecare.org. They also have a great search database on there where you can search for an ALCA professional anywhere in the United States using your zip code.
So our next speaker this morning is Colleen Kemp. Colleen is the Director of Social Adult Day Programs for Early Stage Memory Loss at the Jewish Council on Aging, a position she has held since 2011. Wow, good for you, Colleen. So with over 30 years of experience as a certified therapeutic recreation specialist, Colleen has dedicated her career to enhancing the lives of individuals with physical disabilities and cognitive challenges. Her extensive background spans physical rehabilitation and long-term care across Missouri, Iowa, Maryland, and Washington, D.C., with a more recent focus on community-based services. Colleen holds a BS in therapeutic recreation from Missouri State University and is also a certified dementia practitioner. Her commitment to this field was inspired early in life while caring for her younger sister who had cerebral palsy and a brother who became a paraplegic at age 24. Oof. In 2021, Ms. Kemp received the Leading Age Maryland Excellence in Innovation Award for her creation of KC at Home, a comprehensive remote activity program designed for adults with early stage memory loss during the pandemic. Colleen, that's for 65 and under or 60?
Which one?
The early stage memory loss. You have a
diagnosis prior to age 65. So 60,
prior to age 65.
40
okay.
to 64.
And she'll talk about that more in her presentation. So Colleen and her husband have lived in Montgomery County for 25 years, where they have successfully navigated the challenges of raising 3 children to adulthood. She considers surviving that phase as one of her greatest accomplishments. Colleen, here's an edit for you. I'm telling you, I have 2, and just keeping them alive is a challenge some days. So anyways, our next speaker, we bring you Colleen Kemp, who is a great community advocate, and we're excited to hear what you have to say.
Wonderful. Thank you so much, Kathleen. And thank you, everyone, for allowing me to talk about Kensington Club. I wanted to tell you a little bit about our agency, which is Jewish Council for the Aging. And Kensington Clubs is under the auspices of Jewish Council for the Aging. You can see all of our programs listed here. We are one of many. The most important thing that I wanted to point out is in the 1970s, JCA started with a simple and powerful idea that older adults should be able to live in the homes of their choice as independently as possible and for as long as possible. We're a 503(1) nonprofit, and you don't have to be Jewish to receive our services. I get that question a lot. We serve everyone 50 plus, and our senior helpline is one of our oldest and best assets. You can see the phone number listed above, but I think everyone will get the PowerPoint, so you will have that phone number. You can call for any questions about being older adult services in our area, and they will do their best to help you. It's a wonderful information and resource line.
What if every community offered a club for people living with early stage memory loss? A club that sees the person first. A club that uses positive language that empowers its members, treats them with dignity, and respects them as individuals. A club that provides new friendships when friendship is needed most. A club that focuses on the members' strengths and abilities. A club that provides a purpose to the day and a reason to get up and keep going. A club that is proactive about evidence-based falls prevention and physical health. A club that provides many opportunities to engage in the arts. A club that encourages intergenerational and community connections. A club that supports care partners from the very beginning. A club that leads the way with changing how society views people living with dementia.
So a big question that I get is, what exactly is a social model of adult day program? Typically, everybody is familiar with the medical model of adult day in our community, but social model is community-based. We're specialized to meet the needs of adults aging in place with a diagnosis of early stage dementia. So in around 2000, a lot of programs were popping up. The need for this model was increasing as adults were receiving the diagnosis earlier in their disease process. They were seeking answers as to the cause, the type, what they could do to minimize their memory loss. Medications were being prescribed in the late 90s. I think that's when Aricept came on the market to offer clearer thinking. More and more support groups were being offered to care partners to understand and cope better. And in the traditional medical model, activities are adapted for people with mid to late stage dementia. And this could be perceived as simplistic or demeaning and sometimes a little frightening to an adult who has just received the diagnosis of early stage memory loss. So, question to ponder: who would you want to be with if you received a diagnosis of dementia? You would want to talk and be with people who are going through what you're going through at that exact same time. So the JCA Kensington Clubs started in 2008. We provide weekly sessions for 50 plus adults living at home and that are diagnosed. And the club provides social, purposeful, and stimulating activities. Usually there's 10 to 12 adults in every group, so we keep it very small. Our main goal is to decrease the social isolation, stay healthy and happy for the longest possible period of time, use your brains to the fullest ability at this time. And the club also provides much needed respite for caregivers. The criteria to join the club is the diagnosis of early dementia or MCI, independence with walking, personal cares, eating, and communicating, must not be in denial of the diagnosis, to follow basic safety rules, because we are not a secure program like a medical adult day will have a pin pad to get in and out. We do not have that. Must be followed by their PCP or neurologist for their memory loss prior to joining. If a member chooses to attend and also desires to socialize in a group, they can separate from their care partner. Sometimes that's a real issue. They've been at home so long with their care partner, they have a really hard time separating from them. They must have their own escorted transportation. So people do come by Lyft or Uber, a friend, a family member, Metro Access. There's different ways, but we do not provide transportation for the social club. They cannot drive to the program. So that sometimes is a big problem as people are still driving, even with a diagnosis of early memory loss. We do have inquiry and intake if a caller reports that the member meets the criteria. A 1.5 hour visit is arranged and they come and try out the club. We mutually decide if this is a good fit for the person. Nobody is forced to join the club. So everybody has a buy-in. They desire to be there. They desire to become a part of the group. Here are the benefits of a social adult day program. You can read. We talked a lot about these. We really want to focus on socialization at this point. We do not offer any kind of medical services. The people who join the program are referred to as members, and they pay dues. We do have the benefits. We do have a lot of programs for our care partners from day one. So we do have 2 educational speakers, one per month, and we have a social support group for the caregivers 1 time a month, and that's a drop-in. We have a JCA caregiver blog. We have a private Facebook group for Kensington Club for friends and family. You can't search this up on Facebook. You have to request to join it. We have availability, one-on-one meetings with the director and the manager. We have social work interns. And as of March 1st, we are now part of the ARC Consortium. And you'll hear a little bit more about that, which is our respite coordination program and one of the best kept secrets in Montgomery County, I think. One of our, I wanted to show you kind of where we're located on the map. You can see the little map here. We now have many locations, and I wanted to announce, I'm actually making sure that everybody knows this, both Germantown and White Oak in the community center, our locations there are free. So no cost to join Kensington Club in White Oak on Wednesdays and Germantown on Mondays and Thursdays. And we have a federal grant and also county support for this. They also allow us to use the county location, the senior center and the community center for free. We do not pay rent. That they want it's a real desire in our community. We're very lucky to have our early memory loss programs accessible to older adults at Upper County and Down County. Our Park Lawn location is still private. We receive no government funding for that location. It is $105 per day. And Kesher Cafe, which I'll talk about a little bit more, is our newest program for young onset dementia. This is different. It's early stage young onset, which is a mouthful. The rest of our programs are all mixed age. And sometimes somebody doesn't want to come to Kesher Cafe. They certainly don't have to. They can join the regular program. It's just an option if you are under 65, diagnosed under 65, and you wish to be with others your age. This is a nice little visual of where we are all over the place. So throughout the week, we could have anywhere from 8 to 10 programs going on per week. Our provider team, you can see a few examples here. We have 2 staff, a volunteer, and a CSIP intern per 10 members. So we have a really nice ratio. We have 1 full-time director, me, and a part-time manager, Karen Miller, which many of you are familiar with, I'm sure. We have 10 part-time activity leaders and substitute activity leaders. Karen and I are both CTRSs and certified dementia practitioners. We have 2 activity leaders who are also an LMSW and an LCSW. And everybody maintains requirements for the certified dementia practitioner. Everybody has continuing education every year. We're really lucky to have had 2 master social work interns. It's a real asset to our program. I just want to give you a few of from our annual report. We see our totally, we saw 90 older adults in fiscal year 24. We provided 1,332 hours of care partner respite. I think that's really significant. We were able to take 35 community outings during the year in all of our locations. That's also very significant. This is just a little recap of what caregivers have to say in our last satisfaction survey. We actually just did another one, but we don't have all the results in. But last year, as a caregiver, we asked, have you experienced a decrease in caregiver burden since your members started attending? And I believe we had 30 out of 50 responses. It was 100% yes. Yeah. As a caregiver, do you report an increase in knowledge of community resources and education for dementia caregiving? 100% said yes. How likely are you to recommend this program to a friend or colleague? 100% said yes. And we ask our members questions. So as a member, have you experienced improved quality of life since participating in the weekly meetings? And 100% said yes. We have 3 evidence-based programs at Kensington Club. Otago is a fall prevention training in conjunction with Marymount University. We love it. We get trained every year. I'm a strong advocate for fall prevention, which might be a little unusual for a social model, but personally, I see how quality of life can be affected after a fall. And because they are already affected with the diagnosis, we want to keep everybody strong, flexible, and have good balance. Bone Builders just started in Germantown, and this is also, the county provides this, so it's no cost to us, no cost to the people who are taking the class, and it's only at our Germantown location right now. It's a pilot. We also have an Opening Minds Through Art, which is an evidence-based arts program. We have 2 trained facilitators, Karen and somebody from another staff from the Interages Center at Jewish Council for the Aging, and it's a wonderful program. And our art show is March the 30th. So if you are interested, please email me, and I'd be happy to send you an invitation. Kesher Cafe, I want to mention really quickly, we have 2 parts to this wonderful program. We noticed that we were getting a lot of inquiries from people diagnosed before 65. We have people in our program as young as 52 and as old as 70, but they were diagnosed before age 65. It's a special kind of program. They have special needs and special challenges. They still have children at home, and there's just a lot of stressors. Some are still working. Spouses have to return to work to help support them. So we just felt the need to start this group. It was a grassroots. I had another staff that wanted to do it. We started a free program a year ago on Sunday, once a month, and it was so popular. We applied for a grant, and we were able to get a full program on Wednesdays at Park Lawn once a week. So it provides respite for the caregivers. If you want a little bit more about the Young Onset program, please feel free to reach out to me. I wanted to mention this initiative. It's brand new. We had 6 weeks of practices for an intergenerational chorus with their young volunteers. We had one actually adult volunteer as well. And we had 24 people in the chorus. It was so successful. We weren't sure what we were doing. We had contracted with a choir director who was a music therapist, and we had volunteers and 2 JCA staff, and it was so wonderful. We're going to seek funding and do it again. But we just had the concert at the Ring House on Sunday. And I wanted to mention that. If anybody wants information about this chorus, please reach out. And here is my email address if you need to reach me.
Colleen, thank you so much. That was fabulous. I have some questions. I can personally attest to your programs. I've given presentations there for years, and it's just such a warm, inclusive, loving environment. I really think it's a great service to the community. So I'll save my questions till after Erin speaks. Everyone in our audience, please feel free to put any questions you might have in the chat. And our next speaker, another rock star in the community, Erin Pickrell, who is the director of Griswold Home Care for Chevy Chase. She's both a certified dementia practitioner and a certified senior advisor. She also serves on the board of directors for Bethesda Chevy Chase Rotary Club. Aren't you on the board for Little Falls Village too? Okay. Also on the board for Little Falls Village, reflecting her commitment to community engagement. Takes a lot of commitment to be a part of these boards. So good on you. She's an active volunteer with local villages and has served in the leadership for the Greater Bethesda Chamber of Commerce, and also participates in GROWS, which is the grassroots organization for well-being of seniors. Erin's passion for home care began early as she grew up immersed in the industry through her mother's home care agency in Delaware. After spending several years working for a nonprofit in Costa Rica, Erin returned to her roots and acquired her own Griswold franchise in 2020, which was a great time to start a home care company smack in the middle of COVID. Good heavens. anyways, she survived and thrived and is dedicating herself to building a thriving multi-million-dollar agency. In addition to Erin's professional achievements, Erin lives in Kensington with her husband and her 18-month-old son, balancing the demands of entrepreneurship and family life with grace. I work with Erin frequently, and I'm constantly impressed with her talents and compassion for people who need care in the community. And before I forget, Erin, I just want to mention that I don't know if you mention it in this presentation because its focus is on technology, but Griswold is a member of the consortium in Montgomery County that participates in ARC Respite Care, which is a really valuable program that's part of the grant process. So if you don't know what ARC Respite Care is, ask us after Erin's presentation. So Erin, take it away.
Thanks so much, Kathleen. Yes, I really appreciate that wonderful introduction. And there are a few attendees on here who I know I can share the ARC information with, which will open again in July. And so switching gears a little bit, I am here to talk about technology at home and specifically related to that home care, what you might need if you're working with a care manager or going to the Kensington Clubs. You are obviously going home and might benefit from some technology that can help you stay safe. And so to tell you about me a little bit more, I guess, is that we offer non-medical home care. So typically for someone who is at home, but also independent living, assisted living, any number of communities here in Montgomery County. We do have live-in care. And then of course, 24/7 and hourly, we offer various schedules ranging from 2 hours of assistance with a meal and getting ready for the day to 24-hour care, someone who has more chronic conditions or bedbound, more care demands. And of course, we do have a few packages. If someone needs short-term assistance upon discharge from the hospital or rehab, if you're, working with Kathleen and you have a setback, we can help just for a few days, a few weeks, depending on your needs or the needs of your patients or clients as well. And then I will totally switch gears and talk about technology in, how we are aging now. Of course, we're very aware here, especially, but that, COVID-19 really accelerated the adoption of virtual care. Lots of people, including older adults, their caregivers, their families are using telehealth and virtual care online to get to see their doctors, get maybe medication or prescriptions for those short-term infections, things like that. And most people are pretty comfortable with that now. And then of course, we're getting more into like the voice and video technologies. Of course, Alexa, Siri on our phone, creating those medication reminders is really important for a lot of our older adults we see, and connecting with people, of course, the FaceTime, Zoom, having that connection available, and whether it is someone calling to talk you through your medicine or, calling to check in and make sure that you're taken care of. And then devices. So we do have personal emergency response systems, which are kind of the typical alert buttons that people think of. But now there are lots of smart watches, wearables that can really help you track, not only your steps for lots of people, your activity, but can detect and notify your loved ones about a fall or maybe inactivity if you haven't been moving around as you typically do. And And then of course, so I'm going to talk a little bit about like the smart home and remote monitoring and the Internet of Things. So a lot of our devices now are connected to the internet and can be controlled with Wi-Fi, Bluetooth, your smartphone. They can be controlled by someone maybe out of state, a loved one who doesn't live with you. And so it can help you, control your home without putting yourself in dangerous situations, making sure that the oven is turned off, things like that. And there's many options for security, keys. Specifically, we work a lot with caregivers who are going into the homes. And so if you're giving them a code for your lock instead of a key, that can be, a little bit more secure than having a few keys out there for your home. And then medication is, a huge opportunity for growth in technology, of course. Like we all know that taking medications and that medication management that Kathleen can help with is super important. And there is technology, like the Hero is displayed right here. They're often expensive and have subscription models. But of course, like that is really important if that's keeping you healthier. Those pill dispensers can be really great. And then I'm really talking about, a technology that my home care agency has implemented is called Sensi. And so it's a HIPAA compliant technology that really provides a all-around understanding of our clients' needs, physical, emotional, cognitive, and really helps our clients feel secure at home. Their families have peace of mind, of course. And so it is an audio-based system. So there are these little pods that you can see kind of on the bottom left that we install where the person is spending the most time in their home, typically the bathroom, bedroom, and like living area, kitchen, depending on the size of the home. It can be as many pods as needed. And so it's an always-on virtual care. You just plug it in and there's nothing more to do. We compare it to a fire alarm that, we don't use them very often, ideally, but they're there in case something happens. And, and it can be very important to save your life and save your family's life if you need it. And so the things that we get alerted about, so then once we plug and play, all the alerts come through our staff here at the office. And, things like, of course, the major ones are, falls, big crashes, someone calling out for help, the presence of EMS, if someone says, call 911, or someone says the fire department is here, we get alerts of that immediately. But it also does track things like if there are major sleep disturbances, if someone is saying that I'm having trouble walking today or I'm feeling dizzy, we get alerts for those types of kind of longer term concerns, and we can take action before they become serious. And so these are kind of examples of the alerts that we get. Potential risk for medication errors. I think we do get this question a lot, that you'd be surprised how much our clients, are talking to either themselves or people around them. Of course, someone calls and said, did you take your medication today? And the person says, oh, I'm not sure if I took my medication. That's like, we would get an alert for that type of language. And then we can follow up and say, hey, maybe we're going to do a care plan adjustment to make sure that you're taking your medication. We even get alerts, and it's not an alert necessarily, but we even get notified if there's a great client caregiver match. If they say, oh, I'm so happy you're here. You did such a great job today. You were so helpful, that kind of thing. We also do get the opposite. and so it helps us make a good match with the client and caregiver, make sure, our caregivers are happy where they're working and our clients are, of course, safe and taken care of. And so just some case studies, there are a few kind of higher profile case studies where someone fell and, the agency was able to get them help before they were on the floor for days, say, the caregiver wasn't supposed to come back until Monday and they fell on a Friday, and the agency was able to swoop in and really, really change that person's life, their health in the future. But for me, I think it's really cool. We have a few case studies where, we're taking care of someone 9 to 1, but Sensi is telling us that they're waking up at 7 and they need help at 7. And so just changing that schedule really helps them, maximize their budget. Of course, we all know that home care specifically is expensive. So we're not adding hours necessarily, just changing when the caregiver is helping them. And that makes a huge difference in obviously the client's life and the caregiver's happiness. Getting ahead of care issues. So we had one client who was complaining about sleep, and, and that message, just for whatever reason, wasn't getting to their family, wasn't getting to our caregivers who were helping them, but we were able to check in about it, and they saw a doctor and were able to, get better sleep long term. And then, of course, detecting falls and major health issues. So, a big fall, of course, falls are the big one, but suicidal ideations. And there's another one that I'm missing right now, but presence of EMS or, calls for help, I think are the big ones that it detects. And I think that's actually my last slide too. So we've been really excited to implement this technology, and I'm happy to answer any questions and how it can really help with, the hours that you're at home. Maybe you're in care management with Kathleen, but need, overnight supervision. That's what we can help with. And, when you're at home and not at Kensington Clubs, if you're going there a few days a week and then need some support those other days, we're here, of course.
Thanks, Erin. Excellent presentation. It's really exciting that you're on the front end of this technology in people's homes. And I know that assisted livings are looking at also utilizing Sensi in their facilities, and actually some small group homes too, to better serve their clients. So, if you have 12 hours of care, then and no care the next 12 hours, then Sensi is a reporter basically on your client's activities. So it's really a very cool product that's coming online, again, using technology. So we have a couple questions in the chat. One thing for me, I forgot to introduce myself. I'm Kathleen McGinnis, not the Kathleen that Erin is referring to, but I'm, as a commissioner on the Commission on Aging, and just for Montgomery County resources, just want to remind everyone here that 311 is a great phone number for Montgomery County on Aging resources. They will funnel you out to other programs within Montgomery County. And the 240-777-3000 number is also kind of a catch-all for everything you ever wanted to know within Montgomery County, programs, aging and disability, etc. So I wanted to go through some of the chat questions, and I have a few of my own. Let's see. Chorus is question. Erin was just asking Colleen to clarify. Chorus is early memory loss too, not early onset, right?
Both. So somebody has young onset dementia, of course, they would be welcome. if it's early stage, any age, as long as they are able to still meet the criteria, the independent going, using the restroom and making sure they can follow basic safety direction to remain in the room. Our plan is to expand it and open it up to the community at some point, right? If our pilot program was just the Kensington Club members, but we'd like to do that in the future.
Great. We have another question for Colleen. Are there currently any openings for the day care programs at your
Yes.
locations? All
Yes.
locations or just some?
Yes, we have openings in all the locations in Germantown and White Oak and Park Lawn. I believe there's only one opening right now at White Oak. It's only 1 day a week. So my advice is if you have somebody that might be interested in the program to go ahead and contact us by email, the email that I had on the screen, and you could still go through the process of the actual visit. If it's a good fit, we do have a wait list for White Oak often just because there's one session at that center.
Okay, but it's free, right? White Oak is free?
White Oak is free. It's a little complex, but because we have county and federal funding, it's a little bit of a journey through the year. So on July 1st, dues will be reinstated through October, and then starting October 9th, it will be free again. So we are just so happy to have the grant, which stretches people's resources, which means somebody would not have to pay full dues. It's a $428 savings per month for somebody, plus 16 to 20 hours of free respite. I mean, you can't beat that. So
great. From Judy, she says, I wish there were attractive falls prevention wrist devices. Many people are resistant to wearing anything they feel is ugly. So I have some comments on that, but Colleen or Kathleen or Erin, do you have feedback for this question?
Of course, my response would be I work with an early stage population. So right now we have our in-person classes. We've offered virtual classes. I would say that is what someone could continue to do. As far as devices, that's not something that I have looked into, but I certainly will. Erin, do you know of anything wrist devices that people can wear?
Yeah, I mean, I think that is the big part, is that yes, like people don't like the look of, especially the kind of older school life alert buttons. In my experience, a lot of our clients do not like to wear those, and that is a problem. Yeah, and so that's why, I mean, so speaking from Sensi, like there's nothing to wear. It's really there's nothing to think about to put on or to charge. There are a few kind of, nicer. I mean, Apple Watch has a few fall features, and that is, designed to be a more attractive, sleeker design than some of the other life alerts. But I don't know of any other kind of sleek wearables. But you're right, Judy. If they were more attractive, people might wear them more.
I'm definitely going to be looking into this. There has to be an engineer working on this.
Yeah.
I agree. Like the best looking one I've seen is the Apple Watch, and that's not appropriate for everyone, unfortunately. But I do know they are working on developing their fall. I know they have fall detection technology, and I know they're working on enhancing that further. But for now, that's probably the most stylish option. But again, not the most practical, especially for people that have more advanced cognitive issues. I think the watch can be confusing. So yeah, but a good business opportunity if there's any designers out there looking to get into the safety pendant world.
Yes. My husband had frontal temporal dementia. which is there's a lot of issues with impulsivity control with that one. As in, I'd say, Joe, stay in the chair. I'm going down to the laundry room. Well, wouldn't you know, Joe would be gone when I'd come back. Not good. But I got an Apple Watch for him, which, I don't think is as helpful for the wearer as it is for the caregiver, because if he would go down, it would automatically send a notice to me with his location. So if he was out front on Wisconsin Avenue, where he shouldn't be, the phone would tell me Joe has fallen on Wisconsin Avenue, which I thought was fantastic. It's an expensive wearable. I believe I got one that was $500, and I didn't realize I had to have the one that had GPS in it. So I had to take it back, and I got one that was $550. But since he was a bit of an escape artist, it was really helpful to find him. I could either do find my phone, or it would say that he had fallen. So it is a great opportunity for falls, because it would send people that live alone are worried about falls as well, of course. And so whoever you designate as your first or second contact, it will send a message to them. Looks like you've taken a hard fall. So that's, it's progress. It's not perfect for sure. So we have Patricia, who states, anyone in our audience who has a caregiver that they would like to nominate for her project, who cares? You can contact Patricia, and her email is in the chat here. So I'm guessing that's kind of like the Griswold Caregiver Award. Is that right, Erin?
So we have Griswold has scholarships, and that's open too. I should have mentioned that if anyone knows a caregiver. And I think, Patricia, I will nominate some of our caregivers, for highlighting their stories.
Thanks, Erin. It's a really sweet program. I mean, it's just me being an artist and wanting to do something for the caregivers I've been working with for 40 years or 35 years. So anybody who is working with caregivers, they can be professional, they can be family caregivers. If you want to give them this opportunity, I interview them, and then we create a lovely podcast, and we pop a new podcast onto the world every month. So just my way of trying to do something helpful. I think it helps open the conversation about caregivers and how incredibly courageous they can be.
Yes, certainly. It is not a job for the faint of heart, being a caregiver, having been one myself for many years. So I had a question for Kathleen Morris. Kathleen Morris, do you do medication management for clients?
Yeah, I do. I have a few clients I do that for. And then a few that we've outsourced to pill packs if they have a caregiver that's able to help them take them. But if for somebody that has a lot of med changes, medication management's great. So I'll usually go in every week or two and do med fills, and then I take care of refills and order renewals and all of that stuff too.
Okay, and then, I think, I don't know if you find this a lot or not, Kathleen, but when people come out of a rehab or a hospital, sometimes they're prescribed duplicate medications.
Yeah.
Two different types of blood pressure medications because they missed it in the chart. So you can pick up on those inadvertent mistakes, right?
Yeah, there's a lot. I just had someone come out of rehab, and she didn't have a duplicate, but the social worker at the rehab only sent, I think, 2 prescriptions. So she was out of everything else. So we coordinated with her primary care doctor to get those filled. But yeah, sometimes with transitions like that from hospital to rehab or rehab to home, there's definitely some things that can fall through the cracks. Or sometimes clients can underreport what they're taking at home. So now they have all these new medications in addition to these other ones that the doctor might not have known about. So yeah, it's definitely handy to have someone take a good look at the medications and do just kind of a compliance check, and then also make sure there's no medications that, interfere with one another or potentially aren't safe.
Okay, great. Thank you for that update. Do we have any other? We're coming to a close. It's almost 11 o'clock. Any other questions out there? Let me see. I had one more. Colleen, tell me again what OMA is. I'm not sure I understood what they did. OMA was on your slide.
Yeah, of course. Yes. Opening Minds Through Art is OMA. Anyone can look this up. It's the Scripps Gerontology Department at Miami University, of Ohio, at Miami University of Ohio. It's a wonderful program. It's evidence-based, no fail art making workshop for people with dementia. We adopted it for early dementia. There is a 20-hour training to be a facilitator. It costs $1,000 to do so.
Wow.
We were able to get a Rotary grant. So that, Erin's giving thumbs up. For this, we were so grateful. We were able to get 2 staff trained and then an additional staff. It's evidence-based, so it's very strict. They come for with their partner 1.5 hours a week for 6 weeks, and then they have an art show at the end. And you sell the art pieces for $20 each, and the money goes right back into buying the art supplies. So it's a really wonderful little program. I'm happy to talk about it, or if anybody wants to come and see it, you may just contact me and we can arrange that.
Excellent. Thank you. I had one other question for Erin. Erin, 24/7 can be such an expensive cost for people who need care 24/7 at home. And when I was with a competing company, I was always so envious of your pricing at $450 a day, which is amazing. So can you just tell our audience, what does that look like at $450 a day? Is that 1 caregiver, 2 caregivers?
Yeah, for live-in. And so live-in is unique, and we love it for, really high quality caregivers. You get typically two caregivers each week. So one staying Monday through Thursday morning or Friday morning, and another staying Friday morning through Monday morning. And that person is with you 24 hours a day. They do have an 8-hour break overnight to sleep. And that, is verified each week that they did have at least 8 hours of sleep time. But then, of course, they are there. If something in the middle of the night happens, they are there for that emergency. Of course, they could call 911. They can help out. We're just expecting that that's not happening every night, that there's not an emergency, every night or even every week. And yeah, and it's really provides wonderful consistency of care. We've had a few live-in clients with us since the beginning, 2020 or 2021, and it's our most affordable way to stay really safe at home. You won't have to search again.